We looked at emergency department visits for opioid overdoses, and we saw a 30% increase around the country. The increases occurred in every age group of adults. They occurred in every region. They occurred in men and women. No part of the country is being spared this fast-moving epidemic. This is the second year in a row where life expectancy has decreased instead of increased. We are potentially on track to lose a generation, and we need to make sure that we work together to tackle this epidemic. Someone you know may be at risk for an overdose. We think that wider availability of naloxone to wake people up from overdoses is important. We think emergency departments can be working to help individuals who present for overdoses navigate through to the care and treatment system. And we think family members can be trained in the emergency department about how to look for worrisome signs and how to help their loved one get to care. We know that there are backlogs for treatment and that expanding access to treatment is very important right now. We know for prescription drug use that the need for insurers to cover the non-opioid types of treatment for people with chronic pain are also important. We know that law enforcement and public safety are paying a lot of attention to this, but sometimes the demands exceed our ability to meet them. So there are a number of gaps, but I do think there's a lot of policy interest in addressing those gaps. We're working with health plans and the information technology world to try to make it easier for people to prescribe safely so that the default values are not high doses and long courses. If you're having a dental procedure or if you're having a minor procedure in the hospital, you may not need a very long course of opioids that contributes to opens things up for misuse. We think that use of prescription drug monitoring programs, or PDMPs, is really important. Clinicians, before prescribing an opioid, should look up the record of the individual in the prescription drug monitoring program to make sure they didn't just get an opioid from someone else. We saw over 50% increase in overdose visits in the large urban centers. That might relate to the local drug supply in some of those areas, but I think we're going to need to follow this because we have been seeing changes in local supply, changes in response, and again, this is a very fast-moving epidemic.